Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss general anatomy of the cardiovascular system, part 4. These are the subdivision of the different type of vein present in our body. The caval vein, they directly drain blood into the right atrium of the heart. Portal system connect two set of capillary before draining into the systemic circulation, and ascii system which present in the back of the thoracic wall. The paravertebral vein, valveless vein lying within the vertebral canal. The large vein, like artery, the large vein also have three layers from within outer: tunica intima, tunica media, tunica adventitia. Tunica intima contain endothelium and its basement membrane and subendothelial connective tissue, but there is the absence of internal elastic lamina. This is the difference from artery. The tunica media is relatively thin in vein and contain few layers of the smooth muscle cell, collagen fiber and elastic fiber. Tunica adventitia is the thickest layer on incase vein, and this is formed by the collagenous connective tissue, elastic fiber, fibroblast and longitudinally arranged smooth muscle cell. The valve of the vein. This is the valve of the vein. Histologically, it is formed by the reduplication of the internal tunica intima extend into the lumen of a vein. It consists of collagen fiber, elastic fiber, smooth muscle cell covering the endothelium. Smooth muscle cell exists only in the thick part of the vein leaflet, and vein of the extremity contain valveless, but trunk of the body devoid. Vein of the extremity contain valve, but the trunk of the body devoid of valve. The function of the valve is permit blood flow in the one direction, so blood goes toward the heart from periphery. The histological difference between artery and vein. Tunica intima contain prominent internal elastic lamina in case artery, but absent in vein. Tunica media is the thickest layer in case artery and formed by the several layers of the smooth muscle cell, but tunica media of the vein contain few layers of the smooth muscle cell and collagen fiber connect elastic fiber. The tunica adventitia of the artery is not the thickest layer. The thickest layer of the artery tunica media, and the thickest layer of the vein is the tunica adventitia. So wall of the artery is thicker and wall of the vein is thinner, and the artery is located usually the deeper part of the body, but vein is relatively found in the superficial. Actually, vein has two group of vein usually present in our body: superficial vein and deep vein. Superficial vein is situated below the present in the superficial part of the body, but deep vein is run with the artery. The lumen of the artery is narrow, but the lumen of the vein is wide and irregular, and usually artery contain oxygenated blood except pulmonary artery, and the vein contain deoxygenated blood. Exception is the pulmonary vein, and the vein of the cranium not only contain deoxygenated blood, they also contain CSF. After that, the artery is empty, but vein contain blood. These are the difference between artery and vein. And there is also some difference between elastic artery, medium-sized artery, and vein. So tunica intima of the elastic artery is contain endothelium with basement membrane. This feature is common for all artery and vein. Subendothelial connective tissue also present in all artery vein, all type of artery and vein, and internal elastic lamina is present in elastic artery, but it's not clearly separated due to the presence of huge number of elastic lamina in the tunica media of the elastic artery. So you can easily see the internal elastic membrane in case medium sized artery, and internal elastic membrane is absent in vein. Tunica media. Tunica media contains circularly arranged smooth muscle cell, is present in the all arteries and vein, but the thickness is vary. In elastic artery, it is more thick, medium size is less thick, and in vein is more thin. Tunica adventitia is relatively thinner in case considering that tunica media of the artery is relatively um, less thicker, and in tunica adventitia of all artery and vein contain formed by the collagenous connective tissue, and the in case vein it is the most thickest layer in case vein. These are the example of elastic artery, and these are the image showing the elastic artery, muscular artery, and vein. You see elastic artery, tunica media contain huge number of elastic lamina. The anastomosis between artery. In actual anastomosis and potential anastomosis. Actual anastomosis means end-to-end connection between two arteries, for example, labial branch of the facial artery. Potential anastomosis is occurred in terminal arteriole. It needs sufficient time for dilatation and sudden occlusion of the main artery. Its anastomosis is failed to nourish the affected part, coronary artery. What is end artery? End artery which do not form any capillary anastomosis. End artery are two type, functional end artery and true end artery. These are the functional end artery contain insufficient capillary anastomosis, coronary artery. If there is a sufficient time for dilatation, they can successfully establish connection between two sets of artery and prevent necrosis of particular part. The two artery, there is no capillary anastomosis. One of the examples, central artery of the retina. Vasa vasorum. It is a network of small veins that supply the wall of the large vessels, such as elastic artery, large vein, and the function of the vasa vasorum is they are found in the large vein, and in the outer part of the vein they are usually present because inner part of the inner wall of the artery and vein is supplied by the diffusion from the blood, but outer part is lack of nutrition, and the outer part of the wall of the artery and vein get nutrition from the vasa vasorum. The cavernous tissue are blood-filled space lined by the endothelium surrounded by the trabeculae, and arterial and vein directly open into it. So these are the sinusoidal space, or these are the sinusoidal space, and this space is filled by the blood artery. This is the hallucin artery, and this artery is filled this sinusoidal space, and this blood from this space is drained by the vein, and this vein is drained into the circumflex vein, which is situated in the outer part of the penis. So these are the electile tissue. Now the capillary. Capillary is formed by the single layer of the flattened endothelium resting on the basement membrane. So this is the smallest structure present in our cardiovascular system. It is only formed by the endothelium and surrounded basement membrane. Their function is provide nutrition and oxygen to the cell and help to the removal of the waste product from the cell like carbon dioxide, anti-thopogenic effect, and metabolic function. They are continuous capillary, and there is the fenestrated capillary. Fenestrated capillary again is two type, with diaphragm, without diaphragm, and discontinuous capillary. So you first understand what is continuous capillary. When endothelium is continuous with another endothelium and there is no gap due to the presence of stipe junction, and the basal lamina also continuous, this type of capillary is known as the capillary, continuous capillary, and this type of capillary is very common, and they are usually from different type of barrier, for example, blood-brain barrier, blood-thymic barrier, blood-retinal barrier. So this type of barrier, this type of capillary is used in barrier function. The fenestrated capillary with diaphragm, without diaphragm, both are found in the kidney. Without diaphragm, this capillary is found in the glomerulus of the kidney, and other part of the kidney is found fenestrated capillary with diaphragm. Now we have to understand what is fenestrated capillary. Fenestrated capillary, this endothelium is continuous, endothelium is continuous and basal lamina is continuous. So what is fenestrae? Fenestrae is this tiny pore which present within the endothelium. So individual endothelium is there is this tiny pore present within the endothelium. When this endothelium, tiny pore of the endothelium is covered by a small membrane, the diaphragm, this is known as the fenestrated capillary with diaphragm. When there is no membrane is present, this is known as the fenestrated capillary without diaphragm. Now discontinuous capillary, here the endothelium, there is a gap present between endothelium and there is the basal lamina also discontinuous. So these are the example of the discontinuous capillary: liver, bone marrow, spleen. So the cardiovascular system also contain the lymphatic system. In the later part of the presentation, and in another video I discuss the lymphatic system. So this is all about the cardiovascular, general anatomy of the cardiovascular system. If you like this video, please press the like button, please subscribe my channel and support my channel by subscribing. Thank you for watching.